Proper lighting for a patient with low vision is very, very important. And one of the main reasons for this is because if we get really great lighting, then it effectively increases the contrast of the material that's being looked at, and thereby you sort of get a magnification effect. So a few of the characteristics that we're talking about for lighting is first the format of the lighting. So what we want is what's called a direct and contained light, meaning one that is going to project directly onto the material that you're trying to look at, versus say a standard lamp where the light is going to scatter out of the top and the bottom of a lampshade. So you want a direct and contained lamp. And the next part we're going to talk about is the positioning of the lamp. So you want it such that it is projecting directly onto the material. So we don't want it turning like it's going back toward the face, which can create glare, and we don't want it turning away from it to where we have now shadows down onto the material. We want it coming directly on top of. Another factor that we want to consider is what's called the intensity of the light. So we may want the light to be really bright as the lamp can get, or we may, in certain circumstances, need to decrease the intensity, particularly on days that it's bright sun outside and you may already be experiencing some glare or light sensitivity. And the other option that we want to consider with lighting is what's called temperature of the light. So cool lighting is going to have more of a daylight or a white appearance to it, and when we talk about temperatures for warmer ones, they're going to have a little bit more of an orange look. And most of my patients tend to prefer the cooler or more daylight look versus warmer.